Welcome to this explainer. Today, we're taking some seriously dense medical science and translating it into a clear, fascinating story. We're going to look at exactly how your heart physically grows, changes, and adapts when it's put under stress. So let's just jump right in to the remarkable science of the human heart. Let's kick things off with a pretty relatable question. We all know that when you hit the gym and lift weights, your biceps bulk up in response to that strain, right? It's just a basic biological adaptation. But what exactly happens when your heart is the muscle lifting the weights? You see, since the cells that make up your heart muscle, called cardiomyocytes, essentially stop dividing shortly after you're born, your heart can't just build a bunch of new cells to handle an extra load. Instead, the individual cells themselves literally have to grow larger. The foundational science behind this actually comes down to something called Laplace's law. Basically, this is a physical principle that says the stress on the wall of a sphere, which is kind of like your heart's ventricle, is proportional to the pressure and the radius inside the chamber, but inversely proportional to the wall's thickness. What does that actually mean for us? Well, it means that to decrease that immense wall stress and keep acting as an efficient engine, the heart muscle physically thickens itself. It bulks up by adding structural units called sarcomeres. Here's our roadmap for today. We're going to cover a tale of two hearts, look at the athlete's heart versus the pathological heart, dive into the engine's fuel, and wrap up with reversing heart failure. So, Section 1, two hearts, healthy versus diseased. Notice the perfect divergence here between healthy physiological growth on the left and dangerous pathological thickening on the right. Over on the left side, you'll see the heart expanding in this beautiful, balanced, coordinated way. Both the length and the width of the cells are increasing together. But look at the right side. The heart grows inward, thickening blindly in a concentric manner, which eventually leads to a dilated, failing chamber. Now, both of these are technically forms of hypertrophy, which is just a fancy word for enlargement, but as you can see, they have completely different endpoints. So, the absolutely crucial point to grasp is that while both of these forms of growth start out as a simple adaptation to stress, they are fundamentally opposed when it comes to their molecular triggers and their final outcomes. Physiologic hypertrophy is triggered by healthy stressors, right? Things like endurance exercise or pregnancy. Your heart essentially says, hey, I need to pump way more blood to support this marathon run or to support this growing baby. And the outcome? Preserved or even enhanced function. Pathologic hypertrophy, on the flip side, is triggered by chronic negative stressors. Think high blood pressure, valve disease, or the aftermath of a heart attack. The heart is constantly struggling against a roadblock, and that unfortunately leads to outcomes like fibrosis, which is heavy scarring, and actual cellular death. This clinical data perfectly outlines how these two paths diverge. Take a look at the top. Notice that physiological growth is completely reversible. If an athlete stops training or a mother delivers her baby, the heart just shrinks right back to its normal size without any permanent damage. But that pathological growth inevitably leads to irreversible fibrosis and eventually heart failure. Also, I really want you to take a close look at that capillary network row. This is your blood supply. In the healthy heart, it's increased. In the diseased heart, it's insufficient. Keep that in the back of your mind because it's a completely critical piece of the puzzle we're building. Down at a molecular level, healthy signals like insulin and specific growth factors boost energy efficiency, they increase protein quality, and they actively promote cell survival. Meanwhile, pathological signals trigger a much darker chain of events. We're talking impaired calcium handling, extreme oxidative stress, and the honestly bizarre induction of fetal genes. Yeah, you heard that right. The adult heart desperately tries to revert to the genetic programming it had back when you were just an embryo. All right, Section 2, the athlete's heart, healthy adaptation. When triggered by endurance exercise, the heart activates survival signals through specific molecular pathways like PI3K and AKT1. This creates a mild, perfectly balanced 10 to 20% increase in cardiac mass. But here is the real game changer. The heart doesn't just build muscle, it actively builds brand new blood vessel supply lines to feed that muscle. This incredible process is called angiogenesis, and it's driven by growth factors like VEGF. It ensures that the newly grown, thicker heart muscle receives a plentiful, perfectly matched supply of oxygen and nutrients. Moving on to Section 3, the pathological heart, maladaptive remodeling. Now, under constant high blood pressure or neurohormonal stress, the heart thickens blindly. Because it is just being bombarded by stress signals like angiotensin II, it builds massive amounts of muscle, but it totally fails to build the corresponding blood vessels. The clinical term for this is microvascular rarefaction. Think of it like putting a massive, bulky engine into a car, but never upgrading the fuel lines. The inner layers of the heart muscle literally begin to starve for oxygen. This leads directly to the death of cardiac cells, leaving behind stiff, inflexible scar tissue known as interstitial fibrosis, which eventually forces the whole heart to dilate and fail. Which brings us to Section 4, the engine's fuel, metabolic reprogramming. To keep up with its enormous energy demands, your healthy heart operates like a brilliant hybrid vehicle. In its normal adult state, it actually prefers to burn fatty acids for about 70 to 90% of its energy. Fatty acid oxidation yields a massive amount of ATP, which is basically the energy currency of your cells. And your heart is also incredibly flexible. It can seamlessly switch to burning glucose if it needs to, making sure it literally never misses a beat. But under pathological stress, the heart undergoes this catastrophic event known as metabolic reprogramming. The mitochondria, the powerhouses of the cell, become severely dysfunctional. The heart completely loses its ability to effectively burn those fatty acids, and instead it desperately ramps up glycolysis, essentially reverting back to the highly inefficient energy patterns it used when it was just a fetus. But it's a really dangerous mismatch. Because it can't burn fat properly anymore, toxic lipid intermediates like certain ceramides actually begin to accumulate inside the heart cells, causing even further toxicity and insulin resistance. Ultimately, this metabolic mismatch means that no matter how hard it tries to adapt, the thickened, diseased heart simply runs out of energy to keep pumping. You end up with an overgrown, stiff heart muscle that is completely energy-starved. It really is a terrifying paradox when you think about it. You have a larger, bulkier muscle that is fundamentally much weaker because its internal power grid has totally collapsed. And finally, Section 5, Reversing Failure. The future of medicine. Now, we already use drugs like ACE inhibitors to block those negative stress signals like angiotensin II, which actually helps reverse some of that maladaptive thickening. But the cutting edge of research right now is going so much further. Scientists are actively testing anti-inflammatory therapies, like blocking the cytokine IL-1, to stop the progression of fibrosis in its tracks. They're also exploring ways to utilize VEGF to artificially force the failing heart to grow new blood vessels. And most incredibly, they are targeting something called the Hippo-YAP signaling pathway. This pathway acts as a natural brake on cell division. But carefully turning off these brakes, researchers are trying to reactivate cell proliferation. They're essentially trying to command the heart to grow brand new healthy cells to replace the dead scar tissue. So, what I really want you to take away from all this is a sense of incredible optimism. If we can successfully decode and selectively activate the exact molecular signals found in the athlete's heart, we might actually be able to achieve the impossible. Thank you so much for joining me for this explainer. Please make sure to like, share, and subscribe for more content. And hey, if you happen to be in the Amirpet area, definitely visit Dr. Gangadhar's clinic for any of your physical therapy or emergency pain relief needs. But before you go, I want to leave you with this one incredible possibility to chew on. If we continue to decode these exact molecular signals, could we one day teach a failing heart to completely heal itself? Until next time, keep learning.